Okay, friends, told you I was going to come back to you at 4 o'clock. I know it's a couple minutes after. And we're going to talk about diabetes. Nobody likes to hear about diabetes. Well, they want to hear about it, but they hope that it's somebody else that they're being told about. But anyway, could be you. Because there are 1 in 3 people in the U.S. are pre-diabetic. Pre-diabetic. What does that mean? It means they're on their way to diabetes. Yeah. So pre-diabetes just means you probably still have the symptoms. Excessive thirst, excessive urination, excessive tiredness. Your blood sugar may be popped up, maybe popped down, depending on what you're eating. And then you just kind of go, you know, some people will tell me, well, I have low blood sugar. I'm sorry, that's on your way to pre-diabetes. That's on your way to diabetes. It's kind of just that precursor. Gosh, I remember having that for years. And I would go, I got to eat something. I got to eat something. Even though I was thinner at the time, never even crossed my mind about diabetes. I was on my way. And it's because I was a junk food junkie. Sodas, junk food, whatever I wanted. Because I was so restricted as a child, I thought when I get to be an adult, I'm going to eat what I want. And I did. And so about age 50, caught up with me. Didn't have my picture here, but I have one that's me 40 pounds heavier. So imagine now, 40 pounds heavier. So anyway, so I wanted to come on and talk to you about how to check yourself. You can do this at home. Yeah, you would want to request if you think you're gaining in the middle, can't seem to get it gone, you're tired all the time, excessive urination, infections, bladder infections, yeast infections, you got a wound or a cut or something like that, just doesn't seem to heal, you got a lot of dental issues, a lot of dental caries, a lot of bad breath. If somebody tells you, you know, I can kind of spot person, now that we have masks on, not so much, but you know, if they had that fruity breath smell, is a different kind of smell. I used to smell it on myself. I didn't know what, but it's kind of a fruity, but it's your body trying to blow off those ketones because you got too much, you're too sweet basically, and that's sad. So anyway, so 1 in 3 people are pre-diabetic, and it's like 10 to 15% of the U.S. population is a diabetic. Yeah, pre-diabetic, and then half of those pre-diabetics don't even know they have it. So that's kind of a focus I like to take, is trying to help people identify that they're pre-diabetic, because there's a lot of them out there, and you can kind of tell it in a person's face. It'll be a little puffy around the eyes. You know, some of the telltale signs is there might be some dark spots on the skin. You know, one of the things in women is, especially I've seen this, to kind of get like what they call a little buffalo hump back there. There's a medical term for it, but it's kind of a little roll there, a little fat. That's one of the signs. No hair on the legs, and that's pretty bad because that's decreasing the circulation, shows you're decreasing the circulation. If you get to where it's really shiny, that's really bad because that's a lot of decreased circulation. You have decreased vision at night, or when you're feeling tired, kind of wore out, you just kind of, your eyes are kind of blurry, just don't feel like you're seeing as well. Another sign that your sugar is really high. What else? Oh, just that thirst, that constant thirst. I remember that constant thirst. I always had a bottle of water with me, no matter where I went. And you can kind of spot those people out there. They'll have their big gulps with them, and they'll have soda or something in here because they feel they need that extra jolt of energy. But all it's doing is taking the sugar here, and then it's going back down here. They get more soda, but they always got a big gulp with them. You can spot them easy out and about. So I'm going to come and show you about checking your blood sugar. So that's what I wanted to talk to you about. I was telling you this morning when I was exercising, this is a kit that I really like. It's called Rely On. Rely On. I don't know that you can find it at Target, but I find this one at Walmart. 20 bucks. You get the meter. You get 50 of these strips. And you also get some of those lancets, so something to stick your finger with. So this is what the strips look like. This is my meter. Here. Yeah, even though they've taken diabetes off of my record, I have found that I did enough damage to my pancreas, I still have to watch it. So watch it means not eating that cake, or, you know, delaying the cake, and making sure that I've had some protein, and I may have went for a walk after a meal. I call it food manipulation. So if there's kind of something I want, I may do it in moderation. And I do other things to, you know, like keeping my weight down, hydration, you know, exercise and things like that. So, and then don't overindulge. Don't indulge too much, I should say. Alcohol, oh my gosh, that's just some empty carbs. Sodas, empty carbs. You drink a soda and you've got 200 non-calories empty calories that are just going right in the bloodstream because it's like high fructose corn syrup, right in the bloodstream. That's another really, really bad thing. That's probably one of the reasons that there's so many people in the U.S. with blood sugar issues because of high fructose corn syrup. And they've got ways of hiding it now, of kind of disguising it. They don't always call it high fructose corn syrup. But if it's not saying something you can recognize, it's probably bad sugar. It's going to convert right into sugar, jump into your bloodstream. Your pancreas is going to say, hey, you need some insulin. Oh, I can't give you enough. So what are we going to do with it? Oh, let's store it. So it stores it around your middle. So that's how you get the bigger middle, is because of excessive calories, excessive sugar intake. Body doesn't know what to do it, and it stores it. So if you've got, like I've told before, if you stand up, look down at your feet, and you can't see your feet, I'm sorry, there's something not going on right. You're not metabolizing the sugars correctly. I don't care if they haven't diagnosed with the diabetes yet. You're on your way. The excessive around the middle is a sign that you're on your way. So what I've said before is one of the things I heard Dr. Oz say, take your height in inches, cut it in half, and if your waist is bigger than that, you're probably a pre-diabetic. So anyway, let's get right to this. I know I like to talk about diabetes a lot, but anyway, so your kit comes with these lancets. You just twist that off. You put it on the aperture. This is what this is. I'm not going to pull it off, probably stick myself. But you pull it off, and then you put in your little needle. And it's a nice thing about these meters now. You don't have to prime them. You don't have to check them. You just, you plug your little strip in, and you're ready to go. So you clean your finger with your little alcohol wipe. And then I put my strip. It tells you there's a little arrow there. It says put the arrow right in there. And then it's going to come on. And it says, see that little tick, 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 tick? That's just telling me it's ready for the blood. I like to use my little finger or this finger, and I just got a thing that I end up doing. I just kind of put it right there, kind of pushes it, do it on either finger, and it kind of gives a little extra blood flow. A diabetic is going to have trouble over the years. They're going to become more calloused. So there's my little drop of blood, and it tells me to go ahead and put it on, and then it's just going to count down, and it's going to say, hey, your blood sugar is 117. It's hard to tell, it's backwards, but it says 117. Looks like a 4. 117. Now that is good. I'm going to feel good when I eat supper at night. So when you check your blood sugar, well, that's where it can fool you. Because I always tell people, if you wait till you go to the doctor's office and they're going to do a fasting blood sugar on you, or you're getting your labs drawn, they're going to be a fasting, what happens? You got up, you drank some water, you drank your coffee, you expended your energy, you took a shower, a couple hours or several hours may have passed. You go to the doctor's office, you get your lab results, and you go, under 100, I'm so happy. The doctor says, under 100, you're good. Well, how much energy did you expend to get there? You expend quite a bit. Your body started going, hey, I'm not getting any food, and the blood sugar starts dropping. A true fasting blood sugar is when your feet hit the floor, you go to the bathroom, you wash your hands, you come in, you wash your finger, and you check your blood sugar. Okay, if it is below 100, they're going to say you're okay. But truly, you're a fasting blood sugar, the first thing you got in the morning, you really want it below 85. 85 would be a good number. But the doctor's going to ask you, is it under 100? And you say it's under 100, and he'll say, okay, watch it. And then, but if it's 100 to 110, that's pre-diabetic range. And if you're over 120, first thing in the morning, sorry, diabetes. But you can also check it whenever you've eaten. So let's say you had, what's your biggest meal of the day? Supper. Okay, most people in the U.S. supper. I always like to try to get my biggest meal in the morning, breakfast, because you fasted all night. You're eating whatever you're going to eat. You can actually eat a few more calories in the morning, and that's going to take you a lot longer through the day. Just make sure you have some. We can go ahead and snacks and things like that all through the day, but your lunch and things. But anyway, so you're checking it after supper. Your peak blood sugar is going to be in 1 hour. if you're not on medications for diabetes, your peak blood sugar is going to be in 1 hour. So check that, see what it is. Ideally you want it under 140. Most of the doctors say 2 hour postparental. That just means 2 hours after you ate. That's really ideal for somebody who's on medication. The other thing, I listened to Dr. William Davis. Have you ever heard of the wheat belly doctor? Well, that's him. But he says check it. You're doing a spot check. You check it before you ate, and then you have your meal, and then check it an hour after you've eaten, and it should not be any higher. Should be the same, because your body's in control. And if it's higher, then you're having metabolism issues. So what happens when you put food in, if you've got a lot of carbohydrates, and I advocate for one-on-one. If you're gonna have a carbohydrate, and make sure you have a protein and lots of vegetables in between. So what does that do? That slows that absorption of those carbohydrates. And a protein wants to bind with a carbohydrate. So when it goes into the digestive tract, goes in this, breaks down, blah, 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 it breaks down together. So it slows that absorption down. So it's telling the pancreas, hey, I just need a little insulin to get me through this. Okay, and then it goes on and gets absorbed and then does its work. But if it goes in fast carbohydrates, because you don't even really have any protein, or very little vegetables, eating a high protein, a high carbohydrate meal, jumps into the stomach, breaks down, throws it on out there. The pancreas says, oh, I'll give you some insulin. Oh, I can't give you enough insulin. What are we gonna do about it? Okay, just store it, because you got too much circulating in the bloodstream. And then it stores it as fat. Over time, the pancreas doesn't know what to do, it gets confused, starts breaking down to little cells, start losing those cells, and then over time, what happens? Type 2 diabetes, yep, it just sneaks up on you. Snuck up on me, and it's easy to tell if somebody's overweight. You can probably tell they're probably pre-diabetic, but sometimes it happens so long that some people have tolerated for so long, they actually start losing weight. And then that's really bad, because that person's probably going to end up on insulin. Never want to end up on insulin. Most people think, well, I'll just get the medicine, everything will be happy. No, there's consequences like with that. Metformin, a lot of people will complain of a lot of GI upset, a lot of gas, maybe even have diarrhea. Because what are they doing? They're still putting the carbohydrates in. They think the medicine's going to take care of it. But over time, things are still going to wear out, and then years later in life, you might still end up on insulin. So I would hope you would have a goal. If you're on medicine, maybe a goal to get off medicine. If you're not on medicine, the goal is not to be on medicine. What novel thing. So buy a meter, message me. I don't mind doing a one-on-one, showing you how to use it, reinforcing how to use it. Just check it. It's not going to hurt. If you're overweight, check it. Just check it. Okay, that's all I got. Just want to come on here and show people how to check your blood sugar. It's easy peasy. Have a good one. Bye.